Let the word go forth from this time and place to friend and foe alike that the torch has been passed to a new generation of Americans.
And what they do in England is entirely different. In England, the entire cost of medicine for people of all ages, all of it, doctors, the choice of doctors, hospitals, from the time you're born to the time you die, are included in a government program. But what we're talking about is entirely different. And I hope that while he's here, he and Dr. Spock and others who have joined us will come to see what we're trying to do. The fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago. The British did it 30 years ago. We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private effort. In those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security, those hospitals and every other new hospital, the American people, all of us, contribute 1/2, 1 or 2/3 for every new hospital, the national government. We pay 55% of all the research done. We help young men become doctors. We are concerned with the progress of this country. And those who say that what we are now talking about spoils our great pioneer heritage should remember that the West was settled with two great actions by the national government. One, in President Lincoln's administration, when he gave a homestead to everyone who went west, and in 1862 he set aside government property to build our land-grant colleges. This cooperation between an alert and progressive citizenry and a progressive government is what has made this country great, and we shall continue as long as we have the opportunity to do so.
Mr. President, the critics of your medical care plan have charged that this will be the opening wedge for socialized medicine in this country. Would you care to comment on that, sir?
Well, it's an old argument when a case is lost to argue that it's all right here, but what's it going to mean for the future? Under that argument, there wouldn't have been any progress on any social legislation in this country. That was the argument that was used against the Social Security Act in the 30s. It's the argument used against the minimum wage. It's the argument used against any agricultural program. It is the oldest argument in the world, and was the kind of argument which was successfully defeated on many occasions during the administration of Franklin Roosevelt.
It is a whole new country tonight, ladies and gentlemen, and that is our headline this Tuesday night, day number 29 of Socialism You Can Believe In, the New America.
And that's the word socialist.
But it pushes this country further and further towards socialism.
How is Senator Obama not being a Marxist if he intends to spread the wealth around?
He is a socialist.
This redistribute the wealth comment.
Pat Robertson thinks we're heading for socialism. More and more people that are young are signing right up to be a Marxist and a socialist.
Socialists are walking the halls of the Capitol.
The people will welcome socialism.
A proletariat uprising to overthrow the ruling class.
But what the point? He's a big socialist guy.
We are in a communist system a la the Soviet Union.
It is Marxist. It is socialist.
Well, you believe that this type of intervention has led to socialism in every area where it's been tried.
Socialism is communism and authoritarianism.
This road to socialism, their policies are socialist. We would have been less socialist during the Clinton administration than we are today under Obama.
Most of the people who are writing about socialism don't know anything about it either.
Earlier today, the Supreme Court upheld the constitutionality of the Affordable Care Act, the name of the health care reform we passed 2 years ago. In doing so, they've reaffirmed a fundamental principle that here in America, in the wealthiest nation on earth, no illness or accident should lead to any family's financial ruin. I know there will be a lot of discussion today about the politics of all this, about who won and who lost. That's how these things tend to be viewed here in Washington. But that discussion completely misses the point. Whatever the politics, today's decision was a victory for people all over this country whose lives will be more secure because of this law and the Supreme Court's decision to uphold it. Still, I know the debate over this law has been divisive. I respect the very real concerns that millions of Americans have shared. And I know a lot of coverage through this health care debate has focused on what it means politically. Well, it should be pretty clear by now that I didn't do this because it was good politics. I did it because I believed it was good for the country. I did it because I believed it was good for the American people. The highest court in the land has now spoken. We will continue to implement this law, and we'll work together to improve on it where we can. But what we won't do, what the country can't afford to do, is refight the political battles of 2 years ago or go back to the way things were. With today's announcement, it's time for us to move forward, to implement and, where necessary, improve on this law. And now's the time to keep our focus on the most urgent challenge of our time, putting people back to work, paying down our debt, and building an economy where people can have confidence that if they work hard, they can get ahead. But today, I'm as confident as ever that when we look back 5 years from now, or 10 years from now, or 20 years from now, we'll be better off because we had the courage to pass this law and keep moving forward.